Okay, hello, my name is Jasmine. I'm a student nurse at St. Martin's, and today I'm going to do a newborn assessment on a newborn baby. So we're gonna walk into the room and say hello to the mother and explain to her the procedure, okay? So we're gonna go over here now. And before I even start, I'm gonna make sure I did hand hygiene and that I have gloves on, and that I have compared the baby's wristband to the mother's to make sure that we have the right child. And I just confirmed it and it matches, so that's good. All right, so now we can start. We're gonna start up here at the head, okay? We're gonna note the presence of molding, where the baby's head might have taken a different shape during birth. We're going to notice the presence of the fontanelles, the anterior and posterior, front, back, sides, places where we would normally see it. We're gonna overall just look at the baby's skin in general and see that there's milia present. Look for any redness, bruising. It's normal for the baby to be pink within the first 24 hours, and it is, so that's good. All right, so now, I also noticed some stork bites on the head too. So now we're going to go down to the eyes. We see that the eyes are open and that the baby is in an awake state. So it's in an active state, which is good. I see that the eyes are even. And I see that they're also, they're symmetrical and that they're also even with the ears. All right, so now we're gonna move on to the ears and assess the baby's hearing. And after we assess the baby's hearing, we're going to assess the recoil, where if we bend the ear, it should bounce back. We're also gonna count 2 ears. All right, so now we're gonna move on to the neck and test neck movement. So now we can move the baby's head side to side like this, and it moves without any issue. And now we're gonna assess the clavicles, see if there's any swelling there. And there isn't, which is good. All right, so now we're going to move on to the chest area. We're going to take the baby's auxiliary temperature under the armpit like this, and it should be between 36.5 to 37.5 degrees Celsius. And then we're going to take a moment to take the heart rate for a full minute, and it should be between 110 and 160 beats per minute, and I'm gonna keep track. And while I'm doing this, I'm also gonna take the respirations, and it should be between 12 to 20 respirations per minute. Okay, so everything checks out there, everything looks good. We're gonna notice 2 breast buds right here, and we're also gonna notice that they're enlarged a little bit, which is normal. All right, so now we already assessed the baby's overall skin. It's normal for it to look pink and to see milia. We're gonna go back up to the mouth because I forgot. So we're gonna test the rooting reflex by stroking the cheek. It should turn its head towards my finger. Stroking this cheek, it should turn its head. And now I'm going to test the sucking reflex by letting it suck on my finger, and it is, which is good. While my finger's in its mouth, I'm gonna separate the jaw gently, and then we're going to note any presence of teeth or Epstein pearls, which look like little papules in the mouth. And I note both, which is completely normal. All right, so now we're gonna go down to the abdomen. We're going to palpate for the liver, which is in the upper right quadrant, right below the chest. So I'm gonna palpate gently right here to see if I can feel it. And I do, which is good. And now I'm going to auscultate the 4 quadrants for bowel activity. 1, 2, 3, 4. Okay, so bowel tones are present, which is good. And we're also gonna note the umbilical cord and look for the 3 vessels. All right, so now we're going to take a look at the baby's genitals. Excuse me, if it was a girl, I would look at the configuration, the shape and the size. I would see if she had a pseudomenstruation, which is normal. I would also see if she had any vaginal discharge. And if she did, I would note the color and the odor. All right, so for the male, I'm going to note the presence of the scrotum. If it is bilateral, note the shape and size of the genitals. And now for both genders, we would check the femoral pulse, which would be around this area where the thigh meets the trunk. And I would see that they're bilateral, which is good. Okay, So now we're going to move on to the limbs. We're gonna go back up here with the arms. We're gonna test ROM. Gonna go around town, bend the arms in, go around. Okay, now I'm gonna go up to the hands. I'm gonna note the presence of the palmar folds, and we're gonna test the grabbing reflex, which I stroke the inside, they should grasp my finger, stroke the inside, grasp my finger. All right, and then I forgot to mention when I took the heart rate earlier, I should be taking it at the brachial pulse, which is between the elbow and the upper arm on the inside. And I note it bilaterally as well. All right, and then now we're gonna go around town and do the legs. Around town, like this. And then while we're here, we might as well do Barlow and Ortolani's test. So for Barlow, we're gonna we're gonna bend the knees and we're gonna push them towards the midline, see if we hear any clicking to see if the hip can dislocate. I don't hear anything, which is good. So now we're gonna move on to Ortolani's and we're gonna assume the same position, but just spread the legs, gently apply pressure on the knees, same thing as Barlow's, and see if the hip can be popped back into place if it was not in place before. So it can, which is good. I didn't hear any clicking again, so the hips seem to be good, and we just did ROM on the legs. So you can do this again. And then the foot, we're gonna note the plantar folds. And then we're going to note 5 toes on each side equaling 10. Also 5 fingers on each side equaling 10 for the hands. We're gonna do the plantar reflex where the baby should grasp my finger if I stroke the inside of the foot, and then same with this side. And then Babinski, where if I stroke the outside, the toe should flex. Outside, toes flex. Okay. And we're also gonna measure the length of the legs as well. All right, so now I would go to the mother and do some, before we do that, let's flip the baby over. By this, we can assess the tone. The back should be straight, and we can also assess the spine. The spine should be straight, intact, and present. And then we could also lower the diaper and note the presence of the anus as well. And we could also do the standing reflex by standing the baby up like this, and it should naturally start to step if I gently place it down on the surface. All right, that's good. And then we could do the startle as well. The moral, the startle. All right, so I'm gonna hold the baby like this and pretend to drop it, and it should get startled and wave its arms and legs out like that. And it did, which is good. So, all right. Okay, so now I'm going to go to the mother and do patient teaching. So one thing that's very important for discharge is shaken baby syndrome. It's really unfortunate. 1 in 3 babies die from it. It's when a parent gets irritated and they shake their baby. Maybe the baby's crying too much and they shake it to get it to stop, but it can cause very severe brain damage and it can be very fatal. So if you ever get irritated with your baby, please don't shake it, put it down in a safe place, or leave it in the hands of somebody that you trust, and maybe take a step away for a minute, okay? All right, thank you so much. And now I will go and document my findings, and that's good. Note the date and time of the assessment and what I found.